Have you ever wondered why your heart keeps beating and you are not thinking about it? In this video, we're going to be looking at various electronical pathways of the heart, and we're going to be looking at the SN node, the AV node, the burner of His in this video. But before going to the electronical signature of the heart or the electronical pathways of the heart, let's first take a look at some anatomics and physiology of the heart. The heart is divided into four chambers where we have the right and left ventricle and the right and left atrium. Now, in addition to that, we have the inferior vena cava and we have the superior vena cava, we have the pulmonary vein, we have the aorta, the mitral valve. They are all connected to the heart that help the heart to carry on its function. The blood is going to enter the right atrium through the help of the pulmonary vein that's going to bring blood to the right ventricle, and the inferior vena cava is going to take blood from the upper part of the body into the right atrium, and the inferior vena cava is going to take blood from the lower part of the body to the right atrium. So when this blood enter the various atrium, the atrium is first going to contract. Inferior vena cava, they are going to relax, and then when the vena cava is contracting, then the atrium will also relax. So that's going to help the blood to move through the aorta. So this has just some basic anatomics and physiology of the heart, and we're going to be looking at the heart conduction system, how electronical signal go through the heart that allow the cardiac muscle to contract and allow the volume of blood to flow through. Here is the SNO. The SNO where the depolarizations begin. We're going to see this representation on the ECG graph where the depolarization is going to begin here. And this electrical impulse is going to spread. Firstly, it's going to spread throughout the atrium. That's going to firstly allow the atrium to contract. The inferior vena cava, the superior vena cava to the atrium is going to contract. That push the blood volume, the volume of the blood down to the ventricle. When the atrium contracts, the impulses will not directly go to the ventricles. It will stop. The impulses will gather where? In the AV node. That will lead to different burners. The burners of His. That will lead to the burner of His. And the burner of His, then eventually is going to get distributed. The impulse is going to get distributed to various parts of the ventricle, to the right side of the ventricle and to the left side of the ventricle. Cause the ventricles to contract, forcing the blood to spread through the circulatory system. The ventricle is going to contract through the cardiac muscle. So the contraction is going to happen in the cardiac muscle. That's going to allow the blood to get squeezed from the ventricle to the aorta. After impulse generation, the first contraction is going to take place within the atrium. Now, between the atrium and the ventricle, you have a non-conduction fibrous tissues. Means that these fibers here, they are not electronical. Electronical signals cannot pass through them. The reason being is, and after the contractions of the artery, the impulses will go through the AV node, and from there it spread throughout the burner of His. The burner of His are going to take the impulses to the ventricle. That's going to allow the ventricle to contract thereafter. So you can see the contractions of the heart firstly taking place here. You see the blood coming through the pulmonary vein to the atrium here in red, and you also see this just for understanding, right? The blood is currently filled within the right atrium. What's going to happen here is a contract. After contraction, you see the atrium have already contracted, forcing the volume of blood from the atriums to the ventricle. Also here you can see. So currently the ventricle is filled. Once the ventricle is filled, the ventricle is now going to contract while the atrium relaxes. You see here? So this is the conductive systems of the heart. the way in which your heart is going to contract. The first contraction is going to take place within the atrium, and the second contraction takes place within the ventricle. Let's look at these contractions and how the electronical signals are represented on the ECG graph. So the SN node here that begins the electronical impulses, it starts with the depolarization. That is a P wave. So the P wave on the ECG graph represents the depolarizations where the fibrous of SNO starts. Arterial depolarizations is the P wave. Then between the P wave from here to here is a P arrow inverse. So from here to here is a P arrow inverse. At this point is when the arterial contractions take place. That's the time the arterial contractions can take place. Then you see the QRS complex, the ventricle depolarization. So QRS. So the QRS complex is the ventricle depolarization and also the arterial repolarization. So here is also the arterial repolarization. Then you see the ST segment or the ST interval where ventricle contraction also take place. And you see the T wave where you see the ventricle repolarizations begins. So at the end of the T wave here, that's where the ventricle repolarization is going to begin. Thank you ever so much for watching this video. Please subscribe to our YouTube channel. We have our YouTube channel called Dr. Dennis. We hope to see you in our next video. Thank you.